It is the voice of Indiana County, WCCS AM 1160 and 101.1 FM, and our conversation with Mark Richards from the Indiana Regional Medical Center, brought to you by Marcus and Mack, a law firm representing injured people. And Mark Richards joins us this morning from the Indiana Regional Medical Center. Not busy
Morning,
there.
Mark.
Not busy there at all, are you?
No. Listen, we're putting in work.
Yeah,
for sure.
Well, everybody is, and a lot of people are focusing on health, of course, at this time. And Indiana Regional Medical Center is right at the center of all of this. I'm sure that you've got all kinds of guidance coming from all kinds of agencies and many, many meetings and discussions going on about how to respond to this crisis. Tell me about that whole process. It's been going on for a while.
Yeah, it sure has. And so, we've been meeting clinical leaders, physician leaders. We've been meeting regularly, in most cases, multiple times a day as we prepare for this. And we're basing all of our information on what's being recommended from the CDC and and of course, the Pennsylvania Department of Health.
You, of course, are able to draw upon those resources, and you, of course, within the medical community get all kinds of guidance, I'm sure. Are there agencies or affiliations that you have that help you to prepare for instances such as this?
No, Todd. It really is the CDC,
okay.
and and again the Department of Health. But we've had contingency plans like this in place for years upon years, and so of course you clearly need to update them regularly, which we do. We practice in the summer or in the fall yearly to prepare for these kind of moments. And so while this is a new issue, the coronavirus, we had SARS and MARS and E. coli and H1N1. So the name changes, but, for us, a lot of the practices, procedures, and preparations remain the same.
Take me inside the procedure for a basic visitor or patient arriving at Indiana Regional Medical Center. There are some things that have to be done now that in the past were not a part of that routine.
Right. So we're going to start screening everyone as they enter the building. We're going to start to limit the entrances. You're only going to be able to go in the main entrance or the ER entrance. And so we'll be, doing some quick screens on folks, the basic questions: have you traveled, or what are your symptoms, those kind of things. And so we can try and make sure we head someone off who may have an issue before they, potentially infect other folks. It's all about keeping our patients safe and clearly employees safe as well.
So folks coming to the hospital should use the main entrance or the emergency department?
That's correct.
And they'll be met outside before they enter into the facility for this screening?
That's also correct. And that includes urgent care up here in Indiana. So if you come into urgent care, that you'll have to come around the back of that building. You'll see a tent there. You won't miss it. We have a lot of signage. It's tough to miss, and then we'll screen you there and then send you into the back door of urgent care if that's where your visit is today.
I know that that has been an issue for folks wondering, well, can I go to the hospital for what would be a normal visit any other time? Are there services that aren't available? But urgent care certainly is.
It is, and we're asking people to use some common sense too. Listen, if you think you have an issue, of course, the advice is to call your provider ahead of time before you even come. So, that one is still in place. We're following, again, that's recommendations from the CDC, that you should call ahead if you think you may have some symptoms and you think you may have come across an individual or, been in the counties or states that or outside the country that are on the list. But for now, we're still running business as usual for now.
Mm-hmm.
Things change almost, seems like by the hour. Someone said the other day, I've lived a month in the last 2 days.
Yeah.
And so, we'll continue to make sure we update our website, our Facebook page,
mm-hmm.
Twitter, with the latest information as we receive it.
People were wondering as well, Mark, and again, we're talking with Mark Richards from the Indiana Regional Medical Center. People were wondering, well, should I go to IRMC to get a COVID test?
No, not unless you have. Not unless you have the symptoms or meet all the criteria. Again, it's pretty strict from the CDC on who will get tested and who won't get tested. So it's not about, I think maybe, you're going to have to meet the criteria. You're not going to get tested anyway. So, and that's not an IRMC decision. That's just, we're just following, again, the national guidelines.
Yeah. I think folks might have sort of the idea that everybody should go get tested right away, and that's definitely not the case.
Yeah, that's just not the case.
Yeah.
And I understand that line of thinking, but that's just not the case here.
Tell me about visitation rules, because there are a number of changes in those rules as well.
Yeah, we're going to limit one visitor per patient, and of course they're going to have to be screened as well on the way in. And if you're coming for an outpatient test, we're asking that you only bring, one person with you, one adult with you, for anything that you may need to have done here.
And there are
these are all temporary guidelines, and we're following the best advice again from the CDC, and we're not out on an island here just making things up as we go along. We are glued to their website and their recommendations.
Yeah. Special measures as well for OBGYN patients.
Yeah, that one is tricky. That was also one visitor with them. And I would advise you to call ahead for that. If you're coming in for a birth, I would advise you to call ahead. I don't want to say that there may be considerations, but, again, it's a fluid situation, and we're not trying to, a birth of a child is an important moment in everyone's life, and we do understand that. But at the end of the day, our goal here is to make sure that everyone is safe and healthy.
Mark Richards is our guest from the Indiana Regional Medical Center. Mark, one of the things that people are doing in their homes and in their businesses is they're taking special cleaning measures, they're disinfecting, and I know that's always been important at the Indiana Regional Medical Center, where people are automatically, by being a patient there, they're already vulnerable, and I know that you're doing special things to make sure that everything is clean and is as disinfected as possible.
Oh, that's absolutely the case. Not that we're held to a higher standard daily, regardless of what the situation is. And so, I don't even want to say that we've upped our game, because I want to tell you that we're like that every day. But, certainly everyone has heightened awareness and a heightened sense of purpose here to keep things as clean and safe as we possibly can.
Yeah, absolutely. And just a word about the staff as well, because I know that these are folks that they're right there on the front lines, and you have to be pretty proud of the way that the hospital staff is responding to this.
I will tell you, that's one of the things that that I've been impressed with in each of the meetings that I attend. It's people are digging in here. It's about how can we help, what can we do. That's what we get, because we have special people. When you work in healthcare, that's a special calling, and we're fortunate to have a whole building full of them here. So, I'm really encouraged by what's going on as far as preparation and everyone's willingness to dig in and step up.
Yeah, absolutely. One other thing I wanted to ask you about this morning, Mark, and that is facilities other than main campus. IRMC at Chestnut Ridge, some of the satellite locations. Are there anything that we need to know about going there?
Yeah, we're going to be doing screenings down at Chestnut Ridge too, because urgent care down there. So we'll be doing screenings out front down at Chestnut Ridge for anyone that needs a service within that facility as well. And all of our physician offices are doing screenings. And I would urge folks, if they have a doctor's appointment, to go ahead and call the office before they show up. Some of this can be done, over the phone to minimize the wait outside or in the lobby. But I would advise everyone has a physician appointment, call ahead before they come. And I believe our call center is contacting folks the day before or 2 days before now, so that we can kind of go through everything on the phone with them.
Absolutely. All right. Terrific stuff, Mark. Thanks for keeping us up to date. We'll catch up with you again tomorrow if you're available for us, or you or somebody else.
Absolutely. It's been my pleasure.
All right. Talk to you again.
Thanks, Todd.
There's Mark Richards from the Indiana Regional Medical Center. And you can read more about IRMC's response to COVID-19 by visiting our website, wccsradio.com. As Mark mentioned, their social media platforms, their website as well, information on COVID-19. And there is a news story on our website today about the new hospital patient and visitor regulations, I guess is the best way to put it, for visiting at IRMC. And all in the interest of keeping everybody